Diabetic ketoacidosis, DKA, is a severe metabolic complication of diabetes that carries significant risks of morbidity and mortality. Traditionally, the management of DKA has involved intravenous insulin administration in an intensive care unit setting. However, emerging evidence supports the use of subcutaneous insulin regimens for treating mild to moderate cases of DKA. This approach can potentially reduce the need for ICU admissions without increasing the risk of adverse events, offering a viable alternative in appropriate clinical scenarios. Diagnostic Criteria and Severity Classification. Before discussing the use of subcutaneous insulin, it's crucial to understand the diagnostic criteria and severity classification of DKA. DKA is characterized by three main components. 1. Hyperglycemia, blood glucose levels exceeding 250 milligrams per deciliter. 2. Ketonemia, presence of ketones in serum or urine. 3. Acidosis, arterial pH below 7.3 or serum bicarbonate less than 15 milliequivalent per liter. The severity of DKA is classified based on the degree of acidosis. Mild DKA, pH 7.25 to 7.3, bicarbonate 15 to 18 milliequivalent per liter. Moderate DKA, pH 7.0 to 7.24, bicarbonate 10 to 15 milliequivalent per liter. Severe DKA, pH below 7.0, bicarbonate less than 10 milliequivalent per liter. This classification is crucial in determining the appropriateness of subcutaneous insulin therapy for a given patient. Patient selection for subcutaneous insulin in DKA. The selection of patients suitable for subcutaneous insulin therapy in DKA is critical to ensure safe and effective treatment. Candidates for this approach typically include 1. Patients with isolated DKA who do not require ICU admission for other reasons. 2. Those presenting with mild to moderate DKA based on the aforementioned severity classification. It's important to note that while subcutaneous insulin can be used in these cases, patients still require aggressive fluid replacement and close monitoring of electrolytes. The decision to use subcutaneous insulin should be made on a case-by-case basis, considering the patient's overall clinical picture and institutional protocols. Management approach. The management of DKA with subcutaneous insulin follows a multifaceted approach. 1. Aggressive fluid replacement. This remains a cornerstone of DKA management, regardless of the insulin administration route. Adequate fluid resuscitation is essential to correct dehydration and improve circulation. 2. Frequent monitoring. Point-of-care glucose testing and regular basic metabolic panel assessments are crucial. This allows for timely adjustments to the treatment plan and early detection of any complications. 3. Electrolyte repletion. Aggressive correction of electrolyte imbalances, particularly potassium, is necessary before initiating insulin therapy to prevent arrhythmias and other complications. 4. Addressing underlying causes. Identification and treatment of the precipitating factors for DKA, such as infection, medication noncompliance, are essential for comprehensive management. Insulin protocol. The subcutaneous insulin protocol for DKA management typically involves a combination of long-acting and fast-acting insulin. 1. Initial dosing. Long-acting insulin. 0.2 to 0.3 units per kilogram subcutaneous or the patient's home dose if known. Fast-acting insulin. 0.3 units per kilogram subcutaneous. 2. Subsequent dosing. For serum glucose greater than 250 milligrams per deciliter. Short-acting insulin 0.2 units per kilogram every 2 to 4 hours. For serum glucose less than 250 milligrams per deciliter. Short-acting insulin 0.1 units per kilogram every 2 to 4 hours or transition to a sliding scale insulin regimen every 4 hours. It's crucial to initiate insulin therapy only after ensuring adequate electrolyte repletion, particularly potassium, to minimize the risk of arrhythmias. Benefits and considerations. The use of subcutaneous insulin for DKA management offers several advantages. 1. Endorsed by the American Diabetes Association, providing a level of validation for this approach. 2. Helps manage bed shortages and emergency department boarding situations by potentially reducing ICU admissions. 3. Simplifies insulin administration, with long-acting insulin given every 24 hours and short-acting insulin every 2 to 4 hours. However, it's important to consider that this approach requires careful patient selection and close monitoring to ensure safety and efficacy. Key takeaways. In conclusion, the use of subcutaneous insulin for managing mild to moderate DKA represents a viable alternative to traditional IV insulin therapy in selected patients. Success with this approach hinges on several factors. 1. Appropriate patient selection based on DKA severity and overall clinical status. 2. Adherence to a structured insulin protocol with regular dose adjustments. 3. Maintenance of aggressive IV fluid resuscitation as a fundamental aspect of DKA management. 4. Careful attention to electrolyte repletion and correction of underlying precipitating factors. By incorporating these principles, healthcare providers can effectively utilize subcutaneous insulin in DKA management, potentially reducing ICU utilization without compromising patient outcomes. However, it's crucial to emphasize that this approach should be implemented within the framework of institutional protocols and with close monitoring to ensure patient safety. Question 1. Which of the following is not a benefit of using subcutaneous insulin for DKA management? The correct answer is D. Note that aggressive fluid replacement remains a cornerstone of DKA management, regardless of the insulin administration route. Adequate fluid resuscitation is essential to correct dehydration and improve circulation. Question 2. When should insulin therapy be initiated in the management of DKA? The correct answer is C. Aggressive correction of electrolyte imbalances, particularly potassium, is necessary before initiating insulin therapy to prevent arrhythmias and other complications.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.